Imagine waking up in the middle of the night with a throbbing pain in your big toe. That might be your first encounter with gout. Gout is a medical condition resulting from a derangement in purine metabolism, leading to a state known as hyperuricemia. In simpler terms, it's a buildup of uric acid in your body. This uric acid, which is a byproduct of the breakdown of purines, forms monosodium urate crystals that deposit in tissues and synovium, causing inflammation and intense pain. These deposits are known as tophi when they're large and microtophi when they're small. Now, what's interesting is the role of an enzyme called xanthine oxidase in this whole process. It's responsible for catalyzing the steps that convert hypoxanthine to xanthine and then xanthine to uric acid. So next time when that throbbing pain hits, you'll know it might not just be a random ache. Please subscribe now to join our community and give us a thumbs up to help encourage us to bring more interesting, challenging, and high-quality videos to everyone. Alright, so we've understood what gout is, but what causes it? Well, it's about more than just eating too much rich food. It's about how your body processes it. In fact, gout is primarily caused by a condition known as hyperuricemia, where there's too much uric acid in your body. This can stem from a variety of sources, both dietary and endogenous. Let's break it down. Primary hyperuricemia can be genetic and is mostly due to idiopathic renal underexcretion, which accounts for about 90% of cases. Sometimes it can also be due to idiopathic overproduction or abnormal enzyme production or function. Secondary hyperuricemia, on the other hand, can be due to dietary excess, particularly high consumption of beer, seafood, and meat. It can also be caused by certain systemic conditions or certain medications that lead to uric acid, underexcretion, or overproduction. For instance, renal failure and certain drugs can cause underexcretion, while conditions like malignancy or post-chemotherapy states can cause overproduction. Now, you might be wondering, what triggers a gout attack? Well, sudden changes in uric acid concentration, whether increasing or decreasing, are more important than absolute values. Even with normal serum uric acid, acute gout can occur. Changes in pH, temperature, or initiation of anti-hyperuricemics may precipitate an acute gouty attack. Common precipitants include alcohol, dietary excess, dehydration, certain drugs like thiazide and loop diuretics, trauma, illness, surgery, or starting xanthine oxidase inhibitor therapy. Moreover, gout is often associated with other conditions like hypertension, obesity, diabetes, and even starvation. So it's clear that the causes of gout are multifactorial. It's not just about what you eat, but also about your genetics, your overall health, and how your body processes uric acid. So it's not just about eating too much rich food, but also about how your body processes it. You may be wondering, does this happen to everyone? Well, gout isn't an unbiased condition. Its prevalence is significantly higher in certain groups. Predominantly, gout is most common in males over the age of 45. The reason for this is multifactorial, but it's largely due to changes in metabolism and hormone levels that occur with age, making older males more susceptible to hyperuricemia, and hence, gout. On the other hand, gout is extremely rare in premenopausal females. The presence of estrogen in premenopausal women seems to have a protective effect against gout. It helps the kidneys excrete uric acid, thereby reducing the chances of uric acid buildup and subsequently the formation of gouty crystals. However, it's essential to remember that while these groups are more susceptible, gout can affect anyone, regardless of age or gender. So, while anyone could get gout, some people are more prone than others. Now, how do you know if you have gout? Well, it often starts with a single episode that escalates into recurrent bouts of acute inflammatory arthritis. The most telltale symptom is severe pain, typically in your big toe, but it can occur in other joints too. Imagine waking up in the middle of the night feeling like your big toe is on fire. It's so sensitive that even the weight of your bedsheet seems unbearable. This pain is often accompanied by redness and swelling, giving the joint a hot, infected appearance. Beyond the pain, gout can also limit joint mobility. You might find it hard to walk or move the affected joint. The frustrating part is that these symptoms can come and go. They often subside spontaneously within several days to weeks, giving you a false sense of recovery, only to recur later. Now let's talk about tophi. These are urate deposits that form on cartilage, tendons, bursae, soft tissues, and synovial membranes. Common sites include the first metatarsophalangeal joint, ear helix, olecranon bursae, and tendon insertions. In the realm of gout, The Achilles tendon is a popular spot for TOFI, but how can you be sure it's gout and not just a bad day for your joints? That's where diagnosis comes into play. A key part of diagnosing gout involves a procedure called joint aspiration. In over 90% of cases, joint aspirates reveal crystals of monosodium urate. These are negatively birefringent and needle-shaped, a characteristic signature of gout. X-rays can also play a role in diagnosis. They may show TOFI as soft tissue swelling or reveal punched-out lesions, which are erosions with an overhanging edge. These are signs that gout has been at work in your body, causing damage to your joints. So, a sudden intense pain in your toe might be more than just a stub toe after all. It could be a sign of gout, especially if it's accompanied by redness, swelling, and limited joint mobility. If you're experiencing these symptoms, don't hesitate to seek medical advice. It's better to know and manage the condition early than to let it progress unchecked. We've understood what gout is and how it's diagnosed, but the real question is, how do you deal with it? The answer lies in a two-pronged approach: acute management and chronic management. When a gout attack strikes, it's all about managing the severe pain and inflammation. Non-steroidal anti-inflammatory drugs, or NSAIDs, are often the first line of defense. These are given at a high dose initially, which is then tapered down as symptoms improve. In some cases, corticosteroids may be used, either injected directly into the affected joint or taken orally or intramuscularly. This is particularly useful when there are concerns about renal, cardiovascular, or gastrointestinal disease, or when NSAIDs have been ineffective or contraindicated. Colchicine is another useful medication, especially if taken within the first 12 hours of an attack. However, its effectiveness is limited by a narrow therapeutic range. One thing to remember is that starting allopurinol, a medication used in chronic gout management during an acute attack, can actually worsen the condition. Now let's talk about chronic management of gout. This is where lifestyle changes come into play, along with long-term medication. Avoiding foods with high purine content, such as visceral meats, sardines, shellfish, beans, and peas, can help reduce the buildup of uric acid in your body. Certain medications with hyperuricemic effects, including pyrazinamide, ethambutol, and thiazides, should also be avoided. Pharmaceutical management includes anti-hyperuricemic drugs like allopurinol and febuxostat, which work by decreasing uric acid production through inhibiting an enzyme called xanthine oxidase. Uricosuric drugs like probenecid and sulfenpyrazone are used if allopurinol is not effective or tolerated, but these should not be used in cases of renal failure. Before starting these medications, prophylaxis with colchicine or low-dose NSAIDs is often recommended to prevent acute flares. In cases of renal disease secondary to hyperuricemia, low-dose allopurinol is used, with careful monitoring of creatinine levels. Remember, managing gout is about more than just tackling the pain. It's about addressing the root cause.